think we are live. So, all right, good afternoon. As I promised, I did say we were going to be back, and we are back. This is American Surgery Center Bariatric Program. I am here with Dr. Isaias Irgau. This is our weekly event. We call Bariatric Friday. We are discussing different topics, and today we are going to discuss care coordination of the bariatric program. My name is Kemal Erkan. Today is August 20th. I'm going to ask Dr. Irgau to introduce himself, and we'll start our session after that.
Thank you, Kemal. Very happy to be back on Bariatric Friday. My name is Dr. Irgau. I am a bariatric surgeon or weight loss surgeon. That has been my area of interest now for almost 20 years. I've been performing bariatric surgery for that long. In fact, with my associates at CHRIAS, we really are by far the most experienced group when it comes to bariatric surgery, not only in our state, but in the surrounding counties as well. Very happy to be here, Kemal. Looking forward to another great session.
Thank you. And I do want to introduce, as usual, our other providers in the program, and our team from the surgical bariatric surgeon side, Dr. Irgau, Dr. Gail Wynn, Dr. Mike Peters, Dr. Rose Singh, and Dr. George Ibrahim. And we have Dr. Sachin Vaid from the colorectal surgeon standpoint, and we have a couple of sessions with him in the last couple of months. And from our dietitians who are part of the program as well, Fran, Amy, and Beth, they do work with our patients from the starting of the program until the surgery, and even in some cases, even after the surgery. And among our surgeons, throughout their lifetime, they have done more than 10,000 bariatric surgeries from the surgical excellence. I don't think there is any other programs in the country that has better expertise, which actually is rewarded us with the MBSA QIP accreditation in the surgery center and Blue Distinction Center, designated Blue Distinction Center Plus for bariatric surgery, Aetna Institute of Quality, which was as of August 2020. These are extremely important for the program that we have, because we want to make sure that these are, in order to qualify for these, we have to have certain things in place, and we have to be able to demonstrate this surgical excellence for not only from the preparation side, but from the surgical at the surgery time. And therefore, we are extremely happy that we are able to accomplish these. Now, we have done several different activities, and now we are doing these in the digital world, and we are sharing these with our patients and with public, actually. And today, we are going to discuss the care coordination aspect of this. And I'm going to ask Dr. Irgau to help me with that, as usual. And Dr. Irgau, if we can just start with the maybe qualification of the bariatric, and then we'll go from there.
Yes, absolutely, Kemal. So we're very, very proud that we have a fantastic care coordinator system in our program. And the reason we are very proud for it, Kemal, is because I believe the care coordination-led preparation of the patient is just as important as the surgery itself in terms of really determining the outcome of the surgery and the long-term success of the patient. As you correctly said, bariatric surgery is a very important treatment for morbid obesity. I just saw a patient yesterday. Their weight was in the mid 300, their body mass index 59 kilograms per meter square. A patient relatively young, and yet they have diabetes already. They have medications for high blood pressure. They're using a CPAP machine for sleep apnea at night. They already have developed kidney disease requiring treatment by a kidney specialist. They have joint pain, therefore their daily activity is hampered, right? So that patient, they struggled most of their life with the weight, and they have been, the most successful they have been was in losing about 35 pounds, right? When you are in the mid 300 with a body mass index of 59, Kemal, even with the stringence of the restrictions and diets, that little weight loss is not going to help them really in reversing the illnesses that they are suffering with. And yet they were worried about bariatric surgery. They were worried whether bariatric surgery is something that they really need to look into. And the conversation we've had with them was to really understand the severity of morbid obesity for that person. It's really the central issue in their health, right? And it's not going to get better. It's going to get worse. That person is really a young person, and yet 10 years from now, they may not be able to really do any daily activity if the weight remains the way it is, and it's likely to go higher if it's not treated. What we know, Kemal, is that for a person in that situation, the only effective treatment we have currently is bariatric surgery, weight loss surgery. And the greatest thing about weight loss surgery nowadays, like in our program, it has been really refined to the extent that its safety is very, very high, right? And the reason it is so high in its safety at this stage, Kemal, is because we have programs like the one we have, where beyond the surgeon, there are many, many caregivers that meet on a daily basis to look at the preparation of the patient. Just patient I just told you about, for instance, we would want them to be seen by a cardiologist to make sure their heart is optimized for the surgery. We would want them to see a nephrologist, right? We would want them to see a nutritionist so that they can understand the basics of nutrition, but also preparing for nutrition after surgery. We would want them to see a psychologist because they will be struggling emotionally with the prospect of the surgery and the changes afterwards, right? So all that requires great coordination. The patient has to be able to navigate all this seamlessly, and they cannot do it unless we have a strong care coordinating system within us, right? And your team meets every day to look at every detail of the preparation of the patients and to really coach them in that. Clearly, patients are very busy with their daily life, whether it is being parents, whether it's struggling with more than one job. It's very difficult for them to accomplish all this. It's very difficult for them to stay focused on this. So having that care coordinating team that can take them through this seamlessly is very important. And I believe part of the reason our program is such a high quality and such success program is really because we have that strong care coordination team within our system, Kemal.
So with the case conferences, this is kind of the backbone of the program. Now, we do have care coordination, but without the case conferences, that coordination is not going to be, it's kind of like the hub, like all the buses, they leave in the morning and then at night they all come back. So it's the case conference is almost like the buses are coming back, and then that's our hub, right? So now our nurses, they do go through certain challenges throughout the day with the communication, and we build a certain. I do want to share actually a couple of those with me. Actually, I just prepared that, and the issues when I need them. It was right here. So I have our test buddy as my prep patient. So I know you kind of don't like when I share the quick base stuff, but I'm going to today.
Are you sharing your screen, Kemal?
I'm going to, but I just need communication. But this is Buddy Erkan. So
okay. Our favorite patient.
Yeah. So this is a complex, although it's a complex system that we have with the way that we have in our flow, we try to make this extremely straightforward. So then it's easier for the care coordinators, but also it's also easier for the patient. So we want patient to complete the process. Now, what's completed here is now when the patient has to complete X many nutrition classes, not only we put the dates here, but we want to make sure that there is a checks and balance of, okay, this, I'm going to actually maybe zoom in a little bit. So here it's like we want these to be checked. So that's what the case conference does. We report back. So that's the integrity of the system is checks and balance. So if you don't actually have balance of it, so if someone is just doing it and they are not following up, they may be actually not closing the loop, and we may miss, and we may find out some stuff at the end of the process. So that's why we are doing it. Now, when it comes to the specialists, there's cardiology, in some cases pulmonary, EGD, psych, PCP, and surgical clearance. All these are happening at the different time in different offices. So in the case conference, we actually ask our nurses to report back to us. And then in some cases, they may not have, they may need help. So then in some cases, they may need to hear back from us in the case conference, which we call. Now, for example, then Buddy is missing his blood work. So, well, if he's missing his blood work, then that's something that we have to do early on. As you can see, he doesn't have his hemoglobin and TSH. These are important for us to get in the beginning so that we can actually act on them, because it's not the values only, but what's our plan of action. So we build this in a way that we have Dr. Irgau's, with his clinical leadership, we are able to actually, like in this case, I'm going to just demonstrate something here. So actually, I need to change his email address, Dr. Irgau, because I think we have his email address under your name now. So I have to stop sharing for a second. So because I'm using this now for us to be able to, oh, actually, you know what? On this one, no, we don't have. So on the United Medical ACO, we have, Buddy has two different records. So on this one, we are okay. So now Buddy is missing his blood work. So in the case conference, we are able to send a notification to him. And because we want to make sure that patients are getting our communication in a standard way. So then what's going to happen is when I go to my email, if Buddy is me in this case, then he'll be getting an email. So now why are we building all these is because, so I'm going to share this. I have to kind of close it just because I had something else open on my email. So here it is, Buddy got this email. Because we want to make sure that we are accountable for what we do from our side. So it says, dear patient, my name is Melody Dimat, I'm your assigned care manager. So you are missing your blood work. So then, although we have done this this communication through our patient portal, this is another layer that we added for the patient. So then we are actually taking our accountability, our work to a different level. So we're hoping that we can actually do better. Now, Dr. Irgau, from the surgeons and from the clinical point of view, like what issues do you encounter with patients that we can actually do better? I know we assign the patients, each patient have their own care coordinators, but is there something else that you are maybe encountering that we can do better for them?
Well, I think clearly it's education, right? We have to educate our patients to make them understand why we're doing certain things, why certain things require priority. For instance, you mentioned blood work, right? We order a panel of blood tests, right? And we want those patients to do that. It's part of our evaluation. Not only that, but also it's part of the preparation for surgery. So for instance, if a patient has been sent for blood work, right? And they demonstrate something called A1C, which is too high, for instance, before surgery. We would want that treated. A high hemoglobin A1C suggests that the person has diabetes. But there are different levels of control of the diabetes. If the diabetes is not well controlled, it's not a good idea to go ahead and do surgery, right? You want to control that. So if the blood work is not done early in the process, Kemal, it means that if we discover that the A1C is abnormal, close to the surgery time, it means we have to push the surgery even further because we need to treat that. So doing the blood work early is very important. And the patient can only understand that if we educate them about the importance of this. We do this all the time, but the patient does not do this all the time. So they need to understand the rationale behind it. Another area which is very important, Kemal, is the issue of sleep apnea, right? Now, sleep apnea, for instance, many patients do not know that they have sleep apnea. They suspect they may have sleep apnea, and they may have heard what sleep apnea is, right? But actually, sleep apnea is an extremely serious condition, right? It's a serious condition because people can actually die in their sleep if it's not properly treated, right? It can exert a lot of harm on their heart. Their blood pressure can become uncontrolled if the sleep apnea is not treated, right? So we want that to be addressed. Of course, patients need to understand that by far the best treatment, ultimate treatment for sleep apnea is weight loss, right? So the weight loss surgery will take care of that in the vast majority of cases. But as we take them through the surgery, we want them to be safe. We want them to be treated for the sleep apnea. So when we send them for the sleep study, right, we want them to do the sleep study. How early? Early, so that if we discover sleep apnea, we can send them to the appropriate specialist and the treatment can be started. So all these things can happen and the patient can really become compliant with this if we educate them about that. Mm-hmm. For instance, the patient I was telling you before, they were telling me that they have been diagnosed with sleep apnea, but because the machine is cumbersome, they have not been using it. And then my discussion turned to the importance of treatment of sleep apnea, particularly in somebody whose BMI is 59, who are likely to have a very large neck, a very preponderant back of the mouth, which means that the chance for them of stopping sleeping is very high. So if this puts them really at real danger, if they don't understand that, then obviously they're not going to go back and seek that treatment. And that patient actually told me that that was the first time they've heard the seriousness of sleep apnea, right? And why it's important also to treat it as the patient is getting ready to have anesthesia, right? Our anesthesiologists are pretty strict. If they know that somebody has sleep apnea, they want it to be treated as they approach the surgery. So that kind of preparation adds lots of levels of safety to what we do for our patients, but we need our patients to cooperate with us. And the only way they can cooperate is if they understand the importance of what we are doing with them. So I believe education is something that we have to, continue to work on. And Kemal, as you know, we do have many encounters with our patients before the surgery, right? We see them as consultation, and then we see them at few weeks intervals afterwards, and we reinforce the importance of the various preparatory steps that we take. And the better they understand that, the better compliant they will be. And obviously, it's going to be much easier for the care coordinators to work with them if the patients understand the importance of what we're asking them to do.
So one of the issues for many of the practices is utilizing the patient portals, and I don't believe this is an issue for CHRIAS because we did master utilization of patient portal, and the only reason I know that is because we are part of United Medical ACO, and CHRIAS is at the highest utilization of the patient portal. Now, it's interesting because I also own a primary care practice, and CHRIAS as a specialist is higher than the United Medical Clinic, which is great. So although we are able to communicate with our patients through the portal, and we are able to do everything, all that fine. As you said, the understanding of why they have to do certain things is really important. Now, one of the clearances that our patients have to get is psych clearance. I have seen, I have heard from a couple of cases, a couple of patients that why do they need to get a site clearance? So this is another surgery that someone is getting. It's an outpatient surgery. Like, why do I need to get again, the only reason I'm bringing this up is because our care coordinators are being approached by the patients. Like, they don't have psych issues. So anything that we can tell our patients that would help them to understand why they're getting it?
Absolutely, absolutely. So there are some important contraindications to bariatric surgery. There are few, but there are, okay? And two of those important contraindications to bariatric surgery, Kemal, are untreated severe depression, right? And the second one is substance abuse, right? Now, anyone could struggle with these problems, particularly people who struggle with weight may be more vulnerable to these conditions, right? And surgeons, no matter how adept they are, they're not really as well trained as psychologists to pick up on those issues and to address those issues, right? So the help of the psychologists is very important. Now, by far, the vast majority of our patients go through the psychological evaluation without any issues. But occasionally, we do pick up issues that we may not have seen. And it's extremely important to address these issues before bariatric surgery. Now, there was a time, Kemal, in which bariatric surgery meant the person seeking bariatric surgery, seeing their surgeon and having surgery. But this is something that used to happen over 25 years ago. Since then, we've really gone a long way to improving bariatric surgery and making the preparation for bariatric surgery a multidisciplinary endeavor where there are more specialists involved in preparing, evaluating, and educating patients. And because we have done that, obviously, the quality of bariatric surgery has improved tremendously as well. As you know, there are accreditation programs right now, national accreditation programs that look at the quality of bariatric surgery in each program. And accreditation is given to programs who have excelled, who have demonstrated that they have this type of preparation. And as you know, we at the American Surgery Center are one of the few outpatient surgeries that is actually accredited by the MBSA QIP accreditation program as a center of excellence.
10 out of 9,300.
Absolutely, absolutely. And the reason for that is because we have this program. Now, so having the psychological evaluation adds that other layer of safety. So when patients understand this, Kemal, then they accept that those preparations are necessary steps. So everybody who is seeking bariatric surgery is just better off if there is this layer of evaluation and education as well.
So, well, outside of the bariatric case conference now in the last 3 months, because what we were able to build on top of the bariatric, I do spend another hour with our accountable care organization nurses. It's a different group of nurses. Issues that we see in terms of follow-up and what we have to do with the patients is similar. I say issues, but because in some cases we spend more time for those who need more support.
Yes.
There are certain patients, they need very little from us. They still have to do everything, but they just do it on their own term. There are patients who need more support from us, and that's why we designed this in a certain way. But in that, when I spend 2 hours total, I have to tell you, like it's after the 2 hours, I feel like it's already like 8-9 hours total.
Of course.
Because we go through so many problematic cases, so I feel like, okay, so, and you know that I don't usually say this much, but I feel it, like, because like we want to help them more.
Yes.
So we try to go out of our way, and how can we actually do this better in a better way, in a more efficient way. So we want our patients to know that as early as you start certain steps, we design this in a way that blood work, for example, there may be follow-up needed based on your blood work. Based on your blood work, we may need endocrinology or hematology. So that's why we want those in the beginning. So we don't want you to start the process and then at the end of it all, now you have to wait for the hematology. You have to wait for the endocrinology because it takes time to get into the endocrinology schedule. It takes several weeks. And then for them to finish their process, it takes several months. So for the sleep study, the home sleep study is the simplest test that you can just do right away. So then, because based on that, there are follow-ups that needs to be done. So, and I know our patients are they're watching these events, and we are using these as part of our education, as part of our case conference. So, getting these done as early as possible, because your last two clearances are your PCP. In many cases, they don't want to actually clear you until they have your cardiology and your pulmonary. And then your final one is your surgical clearance, which is your final appointment with us. So try to finish them in certain order and then work with us so we can make this more pleasant experience from our side as much as possible. Dr. Irgau, anything you would like to add that maybe
No, Kemal. I mean, you've said it. I think a thorough preparation really is a setup for excellent outcome. Of course, having very, very experienced surgeons who've been doing bariatric surgery for many years, who not only are experts in, because they've been doing it for long, but they've also taught many surgeons over the years on bariatric surgery. That is the good basis, right? Having that is very, very clearly very important. But on top of that, thorough preparation of the patients really goes a long way to make sure that the quality remains high in our program. So I'm extremely proud that we have that in our program.
So, Dr. Irgau, so I have 4 patients who are interested in participating in our live events. Tanner is working on the screening process. And hopefully in the next couple of weeks, we should have a couple of them joining us. I'm hoping that probably like 3rd week of September, we should have the first patient. These are patients who have done their surgeries. In like between 4 of them, they lost, I think 450 pounds.
Wow, that's fantastic.
We are going to talk to them and we want to share their stories, and hopefully it would help others who are going through this. And well, thank you for being part of this session. And Dr. Irgau, thank you for joining us.
Thank you, Kemal.
We'll see you next
time. Have a good night, everybody. Yeah.